Hello, my name is Nurse Pauline RN. Welcome to my channel. Today we'll be discussing exam number 2, Fundamentals of Nursing exam. Last semester, I uploaded 48 videos of Fundamentals of Nursing. Please check them in my playlist. And for the new people who are coming to my channel today, I also uploaded last semester exam 1, Fundamentals of Nursing part 1 and part 2. Please check for exam 1, 2 videos in my playlist. Included also were clinical guidelines. You will be tested on clinical guidelines in your Fundamentals of Nursing exam, your Med-Surg exam, and your NCLEX exam. Today, we're talking about exam number 2. And exam number 2 is basically a critical thinking. Will physical examination be normal for a young adult or middle-aged adult? Laboratory findings are within normal limits. Instruct patient on health promotion activities. Factors that affect patients' compliance includes education, socioeconomic factors, and motivation. Single young adults interacting with a group of chosen friends, friends from college, friends from work. They may celebrate birthdays together, holidays together. These individuals are viewed as a family. Yoga is used as stress management technique. On admission, assist patients with depressions, young and middle adults, signs of job loss, death in the family, death of friends, divorce. Assess suicide in the family. Middle-aged adults trying to enhance responsibilities related to employment, family life, caring for children, caring for aged parents, are referred to as the sandwich generation. IPV, intimate partner violence. IPV is usually linked to alcohol abuse, pregnancy, unemployment, and drug abuse. STI, sexually transmitted infections, are a major health problem in young adults called chlamydia. Positive health habits to prevent illness later in life are routine screening, diagnostic tests, regular exercises, consistent seatbelt use. Contributing factors to obesity: patients with very demanding job, working long hours, may have 2 jobs. Patients have little time to prepare their meals. Patients, young patients, middle-aged, who eats out from home most days of the week, usually more than 4 days a week, are at risk for obesity. When assessing the knowledge base of a young middle-aged adult with chronic disease, assessment should include medical course of illness, socioeconomic states, coping mechanism of the patient and the patient's family, the need for community and social services. For older adults, when the nurse are recommending to the family choosing assisted living maybe or nursing home, nurses should assist the family by assisting the family to identify adequate staffing available on all shifts, social activities available for all residents. Staff encourage family involvement in patients' care plan and with assisting patients in these facilities. Assessing older patients for depression. Assess recent deaths in the family, deaths of friends. Assess if patients becomes easily distracted. These are assessments for depression in the elderly. For the elderly, assess patients for signs of delirium. Is my patient confused? Is my patient agitated? These are main assessments for delirium. Assess patients for cataracts for the elderly. Do they see glares in the lights, blurred visions, impaired reading? These are signs and symptoms of cataract. Assess elderly patients for signs of abuse on admission. Are these patients having frequent falls or recent falls? Do patients have fractures, maybe of the wrist? Are patients unkept? Do they appear as being unkept? Are your patients having a lot of pressure ulcers on the skin, bruisings on the skin, bruising of extremities? If your families are in the rooms with the patients, please excuse the patients, please excuse the families from the room and assess for elderly abuse, which is common in our society. ADLs includes independence with toileting, bathing, eating, dressing. ADLs stands for patients at risk for adverse drug event in the elderly. Taking different medications. Your patients are taking a lot of medications. These patients are at risk for adverse drug effect. Patients with a history of renal disease, especially in the elderly. ADL stands for Activities of Daily Living, which includes independence in toileting, bathing, and eating and dressing. For the elderly, do reality orientation with the elderly. The goal is to assist your patients to be more in touch with person, time, place. Assessing the elderly on admission for alcohol abuse. Some patients live alone. They are lonely and they are at risk for elder abuse. Assess patients with fractures, falling. That's a symptom of alcohol abuse if it's not an accident. Patients who live alone, poor hygiene, weight loss. Assess for recent death of friends or a spouse. fall risk for elderlies includes impaired vision, leg weakness. Assess patient's exercise history. A nurse uses open-ended question first when assessing the reason why your patient is seeking help. Use open-ended questions. Examples of clinical inferences. Nurse observes her patients, applies information gained to suspect that patient has a problem. Sources of assessments comes from accurate observations of your patients. Assess recommendations from your physical therapist and your speech therapist. These are also assessments gained. Assess results from diagnostic x-rays and laboratory results. These are sources of assessments. Assessment is collection of information, recognition that further observations are needed to clarify your information, comparison of data with another source to determine accuracy. We should always determine accuracy, and these are assessments and collection from other informations. A nurse uses observation to assess your patient's level of function. Is my patient independent? Is my patient self-care, total care, needs assistance with care? Effective approaches to the elderly includes listening attentively, using gestures that reinforces your questions or comment. Maintain direct eye-level contact with your elderly patients. Examples of data cluster. To establish a nursing diagnosis. Data cluster examples are: patient is short of breath, difficulty breathing, dyspnea on exertion, pursed lips breathing are example of data clustering to determine or to establish a nursing diagnosis. When planning patient's care, during a handoff, which is from one nurse to the other, whether it's at the beginning of the shift handoff, at the end of the shift handoff, or handoff during the shift. You can also have handoff discussions, one nurse to the other, maybe coming from another unit, or you may be giving handoffs, maybe on the phone or verbally, to another nurse who you are sending your patients off to another floor. You have to give report. Handoff are reports given one nurse to another. When planning patient care during a nurse handoff of patient to another nurse, do your pre-work, such as checking your patient's lab reports. Also include the patient's family in planning during your handoff discussion if it's okay to the family. When a nurse is ordered to perform an unfamiliar procedure, this is a doctor's order, you will Check scientific literature or policies and procedure books, which are usually located at your nursing station. Reassess your patient's condition. Collect all necessary equipments. Consider all possible consequences of your procedure. We always consider our consequences. In a court of the law, the nurse is responsible. Unfamiliar procedures, ask your charge nurse for assistance, please. When you're reviewing clinical practice guidelines of the hospital before doing a procedure, clinical guidelines makes it easier for nurses to do their work. Clinical guidelines, for example, checking your procedure manuals, sets a level of clinical excellence. Clinical guidelines in your hospital delivers evidence-based interventions. Evidence-based. You are responsible for your care. You are responsible for possible consequences of your procedure in a court of law. Implementing care for your patient who does not take care of themselves, who are non-compliant. We should try to get further information from your patients to decide if patients maybe has problem with seeing, understanding, their educational level, maybe their socioeconomic status. There are usually reasons for non-compliance. When implementing cares, when implementing cares on your patient, if you have a PCT, that's your tech, always assess your PCT's level of knowledge. Assess, especially if it's a new PCT you are not familiar with. Make sure when you're implementing cares, your PCT knows how to properly use a blood pressure machine, that your PCT knows how to use the glucose testing machines. Always assess your PCT's knowledge in maybe collecting stool or urine collection. Always assess your PCT's knowledge coming from a new floor to assist you on your floor, maybe because of shortages. You always assess PCTs when you're implementing cares of your patient. That's care implementation. Examples of direct care is like cleaning, dressing, bathing your patients. Hands-on, that's your direct care. If a nurse and a tech is bathing a patient and they discover bed sores for the first time on their patients, maybe during admission, the nurse will do a wound care consultation or an ostomy care consultation. This is a sign. This is what we call indirect care. The nurse is not the one who is directly going to take care of this pressure ulcer. She is gonna do a wound care consultation to have the nurse who is expertise in doing wound care to come and take a look at this patient or to come and take care of this patient. This is indirect care. During implementation, reassess your patients. Compare assessment findings to validate existing nursing diagnosis. Decide if the intervention remains appropriate. Modify your care plan if needed. If you have a patient who is a post-op patient and your post-op patient has not voided in 8 hours, you will notify your doctor to avoid complications for post-op patients. This implementation is a skill called cognitive skill, which includes critical thinking and decision making. So you always communicate your doctors when something doesn't seem right, something that you can avoid complications for your patients. Examples of direct care: counseling, discussion of patients' options with the patients, protecting patients from injury and self-harm, using safe handling during positioning patients. HCA-HPS stands for Hospital Consumer Assessment of Hospital Providers and Systems. These measures quality of care within the hospital. During a nursing admission, the nurse finds out that our patient is non-compliant taking medications, or patients may be missing doses. Nurses should determine all consequences associated with patients missing doses. Use open-ended questions, please. Interventions with nursing diagnosis. Example: disturbed sleep patterns. Rule out noisy home environment. These interventions should be directed to reduce noises. These interventions should be based on the basis of research shown to be effective in promoting sleep. Interventions should be acceptable to the patients and families. Examples of collaborative interventions. Example: maintaining an IV fluid normal saline at the rate of 100 cc's an hour. This is a doctor's orders. This is an example of collaborative intervention. Counseling, consulting a dietitian on initial foods to offer a patient. Consulting a dietitian is an example of collaborative intervention. In managing of care with your patients, don't forget your 5 rights for delegation. You'll delegate the right task, the right circumstances, the right person, the right direction, and the right communication. In managing patients' care, patient-centered model for hospitals means the healthcare team are full partners in decisions related to patients' care. This is patient care model for hospital. Healthcare team are full partners in decisions related to patients' care. In medication errors, the nurse will do an incidents report and communicate with the doctor that an error has occurred in administration of medications. This is exercising accountability. All nurses are accountable for their patient care. This is accountable. Staff of nursing discussing implementing. This is called interprofessional rounding. Staff of nurses discussing implementing. This is interprofessional rounding. This type of rounding allows team members to share information about patients to improve the patient's care. This interprofessional rounding provides opportunity for early patient discharge. This type of interprofessional rounding improves communications among healthcare team members. In managing of care with your patients, after a change of shift on a assigned patient, the nurse prioritizes the task that needs to be completed. This is an example of the practice of time management. As nurses, we have to practice time management. We prioritize our tasks. Patients post-op surgery, second post-op day, the patient is stable. It's okay for a PCT to ambulate this patient. Our PCT only takes the vital signs, only ambulate patients who are stable. If your patients are first post-op day, they are not stable, the PCT do not ambulate these patients. They do not take the vital signs. PCT takes care of stable patients. PCT ambulates only stable patients to the bathroom alone with assisted device walker. If she needs help, she can call for standby assistance. If a patient is going to the OR operating room, if the patient is stable before going to the OR, it's okay for your PCT to ambulate your patients to the bathroom. We need our patients to go to the bathroom and void before surgery. If your patient is going to the OR and your patient is unstable, your PCT should not ambulate that patient to the bathroom. Components of interprofessional collaboration. Components of interprofessional collaborations. Nurses are viewed as team leaders because they are working together considering patient care. Effective interpersonal collaboration requires mutual respect and trust from team members. When you go to the hospital on the floors, all nurses collaborate together on the floor. We all work as team members on the floor. We all establish a trusting relation. This job is hard. It takes a team. It takes a trusting relation. It takes collaboration. Open communication improves team membership. The goal of interprofessional collaboration is to improve quality of care for your patients. Managing care. Characteristic traits of transformational leader. A transformational leader is our nurses managers on the floors. They're different kind, but in this case our transformational leader, this manager regularly makes round with her staff nurses to gather inputs on unit decisions. This nurse managers send thank you to the staff in recognition of a job well done. The transformational leader has a suggestion box on the floor for ideas from the other registered nurses on the floor to input suggestions on how to improve our units. In clinical decision making, the nurse assesses patients and use assessment findings to identify patients' problem and develop an individual plan of care. I will be uploading exam 3, which some people will need in exam 2, depending on what kind of nursing programs you have. I will be uploading exam 3 shortly. As I said, exam 2, you will find it's all about critical thinking. Thank you. Have a good day. I'll see you in my next video. Take care, everyone. Stay blessed.